Hello and welcome to Keep Talking, a community dialogue about mental health. My name is Gay Maxwell, and I'm the manager of the Office of Continuing Education here at the Brattleboro Retreat. The Brattleboro Retreat is a 183-year-old mental health hospital and addictions treatment center here in southeastern Vermont. It serves children, adolescents, and adults in a variety of inpatient and outpatient and residential services. The Brattleboro Retreat provides courage and care when being human hurts. Today, I'm thrilled to have in the BCTV studio Irwin Krieger, who is a social worker who's traveled all the way from New Haven to do this show with us. He is also the author of Helping Your Transgender Teen, a guide for parents. I'm going to hold this up for a while longer so that those in the studio audience can get the title, Helping Your Transgender Teen, a Guide for Parents, and this is Irwin Krieger. And also in the studio is Darcy Gingerich, who is a senior program therapist at the Anna Marsh Clinic at the Brattleboro Retreat. And thank you so much for being guests today on Keep Talking.
Thanks for the invitation.
Now, the reason that you both are here is that Irwin Krieger agreed to present a full-day conference tomorrow about transgender youth and working with transgender youth's families. And you will be giving a presentation to over 100 people tomorrow, over 100 mental health professionals from all over New England. And I wanted to ask Darcy as well to attend because she is to be here on the program because she provides care to transgender kids and adolescents here at the Brattleboro Retreat. So I really wanted to ask you both lots of questions and really to help our studio audience understand what exactly transgender, the adjective transgender, what does that mean? When somebody describes themselves as transgender, what are they saying?
We think in terms of three components of who people are. One is their assigned sex when a child is born, usually a medical professional in our country, but certainly everywhere somebody decides pretty quickly, is it a boy or a girl? And even though we know there are variations in people's genetics and biology and even external genitalia, it's pretty much a binary system. Everybody is considered either male or female at birth, and that's their assigned sex. Their gender identity is who they feel they are inside. So whether as they're growing up, they have a sense of themselves as male or female, or maybe neither, maybe some combination of the two. Maybe they feel they are something other than male or female. And transgender people generally have a discordance between their assigned sex and their gender identity, so that either their gender identity is the other assigned sex, or their gender identity is neither male nor female, so it doesn't fit with their assigned sex. We also think in terms of gender expression as a third aspect of who people are. Gender expression is how we move through the world in ways that conveys our gender to other people. It may be the way we speak, the way we move, might be our interests, the extent to which our interests fit in with stereotypical ideas about how boys or girls in a given culture may act or what they may find interesting or exciting. And if someone's gender expression is strongly sort of beyond the realm of what the culture accepts for people of that assigned sex, then that person may also identify as transgender, that they may feel that their assigned sex and their gender identity match, but the way they live in the world doesn't at all fit with the social concept of male or female.
Darcy, do you have anything that you would like to add to that?
Well, sometimes I think when I talk with parents a lot who ask a lot of questions about this, of course, usually when they come to discuss concerns about their own child, I talk a lot about how gender expression, that all of us have gender expression, all of us have had a gender journey, and that when that incongruence is there, it's really horrible. So if we just imagined for a moment that we were, didn't feel like we were the sex that has been assigned to us, that we thought we were a different gender, what that would be like to be in the world if we didn't match what everybody else is reacting to us as. And another thing that I often talk about is how we each have sort of multiple gender expressions. So for example, here I am in my TV clothes, but if you came by my house tomorrow and I'm busy stacking wood, I might be dressed in my jeans and a flannel shirt and a ball cap and look mannish, or something like that. That's still gender expression. So all of this is on a continuum, and each person's journey is an individual journey, and if you've met a transgender person, you've met a transgender person.
Mm-hmm. So, Darcy, you referred to this sense of that, a sense of feeling that one is not inside what one appears to be on the outside. Now, is that what the term gender dysphoria refers to, or gender discomfort refers to?
Not really. I think that that's really more what a gender identity is, and the gender dysphoria comes more from really being extremely distressed about maybe puberty. When that happens, oftentimes I'll start seeing kids then, like they will have managed to get through their early childhood and, 6, 7, 8, 9, then they start, or their friends start developing secondary sex characteristics, and all of a sudden then they're feeling extraordinarily distressed. Mm-hmm. But no, I think that we all have a kind of an identity as a gender, and that it happens very early. And like, as opposed to sexual orientation, which those kinds of questions come up in adolescence later usually, mm-hmm. Gender identity is something that happens when we're really little kids, more frequently.
How early do you tend to see kids show up in your office? Actually, what are the events that might mm-hmm. bring a child or an adolescent into office?
My practice was for teens and young adults. So the youngest kids I happened to see were maybe 9 or 10, just because I don't do play therapy. And so if you're going to work with younger children, you have to have the flexibility to work with them in the way they need to communicate. Mm-hmm. But if the question, I assume, is more about when do kids come forward as transgender in some way, or sometimes we talk about kids being strongly gender nonconforming. Sometimes we do see 3 and 4-year-olds who are very clear about expressing that they feel that who they are is different from the sex that people presume them to be. Another very common point for people to come forward about being transgender is at the onset of puberty. So there are many young people I worked with who didn't think about gender much in their childhood, and other people who knew them didn't see them as gender nonconforming. They seemed to fit in the realm of what we expect of boys or girls, whichever they were. But when they hit puberty and their bodies started moving in a direction of masculinizing or feminizing, then they felt like this is the wrong direction for me. And so I would say those are the 2 most common points at which people become aware of this. But there are many people who have come to see me in their 50s, 60s, 70s, and some of them knew when they were 3, but some of them didn't really have the awareness until they were adults. And I imagine that's going to change now that these ideas are out in the culture. Someone who's 70 now, when they were 12, they didn't have access to any information about this as a possibility. Mm-hmm. So I don't know if that's going to continue to be the case, but it may be. There may be people for whom this emerges in their 20s, 30s, or whenever.
I see you nodding your head, Darcy. Have you seen children that are younger, and how do they describe what's going on for them?
Well, I do see children that are younger, mm-hmm. and sometimes it's just that the child is really clear that they are the opposite of what they've been assigned. They begin to do things like refusing to wear the clothes that grandma sends for Christmas, or they only want to play with their siblings' toys and not things that people have bought for them. And then on the other hand, I think that there are some families where just everybody gets to play with trucks and everybody gets to play with Barbies, and so there's just much less pressure to be conforming to one gender or the other.
Mm-hmm. do you, you know, I think among a lot of people, they think, well, you know, kids go through stages, and, you know, this child may be a tomboy for a, you know, the old expression tomboy for a while, and this, you know, my son likes to dress up in his sister's ballerina outfits, and aren't they going to outgrow this, and why would we make a big deal about this? And I'm sure lots of people have that question. Can you answer that, both of you?
Sure. So I think that when kids are in those different stages, there is a lot of exploration. And I think that sometimes just not making a big issue about it is the best thing to do. On the other hand, if a child is consistently and persistently pushing that they're a gender different than the one that they've been assigned, I think that we have to pay special attention. And I think that we now have some resources available to us that weren't available many years ago, where we can postpone puberty and give children time to make that decision and really sort that out for themselves. And I believe that there, in fact, many children who may be put on puberty blockers who then decide that they don't want to be on the blockers anymore and will continue with going ahead with the gender that they've been assigned. And then for those children that have been put on blockers that really need them, it can be truly life-saving in some ways, because they don't end up going through puberty and developing those secondary sex characteristics that are so uncomfortable to them.
Let me ask you this, just to go back. I'm sorry.
I was going to just tag on to that answer.
Please
so
do.
We do know that if you look at kids who are 5, 6, 7 years old who are asserting a gender different than the one they were assigned, that some of them, when they're 12, will actually be back to their birth assigned gender. And we don't really know how to distinguish yet, how to predict exactly who's going to be who. And many people who work extensively with young children who are asserting transgender identities are doing research on that now, and really trying to get as much information as they can about these kids, and then watch them develop, and then look back and say, well, was there some way we could have sort of guessed ahead of time to kind of ease the child's pathway. And some of the clues that people are looking at are things Darcy mentioned, like kids who are persistent and insistent and consistent. It's a phrase that they use.
Yes, I've read that.
And also kids who say, well, I am a boy, not just I wish I were a boy, but I am a boy, the kind of language kids use. My feeling, and I think the feeling of most people in this country who are working with young transgender children, is we should give kids room to be who they are. And if this child who we've been thinking of as a boy wants to go to school as a girl and is really adamant about it and is really distressed if, I would say, she can't wear a dress to school and play with the other girls, be considered one of the girls, I think we should allow that child to do that, because why would we want a child to be miserable just because we're worried that they may change their mind in 4th grade? I think we have to create a culture where if they change their mind in 4th grade, we just say, okay, this is a child who lived as a girl for a number of years, now they're back to living as a boy, and this is their pathway.
So a child comes to your office, or a teenager comes to your office. Obviously, there's a family involved because they're that young. What are considered the best practices? How do you begin as therapists in the office with not only the child but the family?
Well, I think the best practices for the child is always to support their freedom to express their gender as they feel inside and to live in the way that feels right to them, and then create as much safety around that as you can. So we do know that perhaps the most important aspect of safety is having a family who accepts or even celebrates that their child is exploring gender diversity. And we know that not just transgender kids, but LGBT kids with highly rejecting families have very high rates of depression, suicide, self-harm, substance use. So the biggest safety concern is that the family environment should be supportive. Again, supportive of someone just being who they are and having the freedom to live in accordance with how they feel they are as is appropriate for that age.
I imagine that depending on the family, there can be a learning curve. And I wonder how you address that.
Well, I think there's a really big learning curve for some families and not so much of one for others. I think I've seen some families where children or adolescents have known for quite a long time that they're different, that they're feeling as if they would like to make a change, and they haven't been able to talk to their families about it. And then they finally do, and now they're absolutely insistent that mom and dad must use the pronouns that they want and all of that. And the parents are just perplexed and confused. And sometimes I use the analogy of, well, your child has climbed Mount Monadnock without you, and you're down at the bottom, and they're looking down saying, come on, hurry up. And meanwhile, it's a pretty hefty climb to get up Mount Monadnock, and you don't have all the information or the tools that you need to have. And that sort of settles people down some a little bit. Sometimes it can settle the kid down enough to be patient with their parents and give the parents a little more time to be able to catch up.
Mm-hmm.
I think it's a learning curve as far as the information, but what's even more challenging is parents have, understandably, many fears and concerns about what this means for their child and for themselves. So I find the family therapy, part of it is sharing the basic information about how we understand transgender identities and providing them some context within which they can understand their child. But the bigger challenge is helping parents get past the fears they have, fears of some kind of terrible outcome for their child, that they will undergo in their teenage years some medical interventions that later they will regret, or even just making what we call a social transition. Like for the young child, that's all a young child is going to do, just say, I'm a girl, my name is Susie, please treat me that way. You know, that's the social transition. For a teenager, the social transition has to include maybe more adaptations in appearance and so on, because puberty may have already started, or puberty blockers, as Darcy mentioned earlier, which just kind of freeze puberty to buy some time. So parents are concerned about children doing things they may regret later. They're concerned about their child being harassed or physically assaulted, or their child having a future which includes no love life, no work, no friends, no community. And parents are also concerned about how it affects them. It's a loss for many parents that they know this child as a boy or a girl, and now they find out this child who they've loved and cherished for all these years as one kind of person, that they maybe misunderstood who their child was, or their child isn't the same person they thought. Or parents may feel ashamed about what people will think of them, or they may feel guilty, and so on. So I think there's the information for parents, but I found again and again that the heart of the family therapy was really working with parents on their fears and concerns. And one of the reasons I wrote the book was to just for parents who maybe don't have access to counseling or who need some introductory reading material to kind of get them oriented. The book goes through the basic information and then addresses briefly the different fears and concerns and how parents can begin to come to terms with the things they're worried about.
Mm-hmm. I wonder what happens in a family where you have perhaps one parent who's, I'm all in, let's do this thing, and you have another parent who is, no way, I'm not going down that path. That's out of my experience. I don't want to know about it. So how do you work with that?
I feel like you really have to focus on the parent who's lagging behind, mm-hmm. because otherwise you set up a situation where you have like the good guy parent and the bad guy parent. Mm-hmm. So we have to try to figure out what are the stumbling blocks for that parent. Again, of the many different fears and concerns parents can have, not all parents have the same ones. Mm-hmm. So to really sit with that parent and understand what's their objection, so to speak, what are they worried about, and then the response has to be tailored to that. It can, just as trans people are so varied and different, parents are also varied and different, and even though there's sort of a cluster of concerns that parents have, how it affects one particular parent mm-hmm. is very individual. And so the assistance and the treatment has to be individualized. One thing I would say that's helpful, I think, for all parents is to talk to other parents of transgender kids. And in Connecticut, where I am, there are a number of parent support groups, and perhaps there are up here as well. And that is really, really helpful for parents because they meet other parents who had the exact same misgivings, but their child is maybe further along in the process. And then they can see how another parent who felt just like them, after seeing their child make some transitional steps and thrive, is is feeling happy for their child. And so that parent can really help reach out to the scared parent.
Darcy, have your families that you've worked with been able to access such groups in Vermont? Are there groups like that available in Vermont?
There is a group here called Green Mountain Crossing that does a lot of transgender education and support, and they ran some potlucks and book groups, and they run an adolescent group. And I believe that the parents that have been involved with some of those kids have met at those kinds of gatherings and sort of talked amongst themselves. So
we'll make sure we get links to those
I was going to say,
resources.
for people who are watching from anywhere in the country, or I think even in Canada, PFLAG is probably the place to start. It's Parents and Friends of Lesbians and Gays, PFLAG. That's how it started, and the group's been around for many years and has a very strong transgender focus now. And there are chapters in every state and then many chapters within the state, and that would be really probably the best kind of all-purpose link for people who are looking for support groups for parents. There are support groups that are not affiliated with PFLAG, but that's the most broadly, diversified group in the country.
I see. Okay. So how about the schools? What are your experiences with working with schools to help with a transition?
Well, in Vermont and New Hampshire, we've been really very fortunate for the most part. There have been some concerns about bathrooms, but those were worked through relatively quickly. And over time, as I've been seeing more and more families and children, it seems as if the concerns and the issues just start being less and less as far as the school is concerned. The school is pretty open to whatever the child needs, in my experience. And I know that that's not the case all over the country, but I think at least in northern New England, we've been pretty fortunate.
How about Connecticut?
Yeah, my experiences have been the same. Again, I've been working more with middle and high school students than elementary. And what I find is the young people are very, very open-minded and welcoming, with the exception of the few difficult peers who are unkind to lots of people who have their own problems they're dealing with. But if you look at the vast majority of the peers of the students who are transitioning that I've worked with, they've really been very respectful and accepting. The adults, very more so. I think the school administration and the school personnel that I've dealt with all have been, people who mean well and who are really trying to help their trans kids. But sometimes there are adults in the community, or there may be somebody on the school faculty who is resistant or somehow opposed, and so then there can be more challenges to face. But I think the outcomes are much better than people imagine they would be.
What are the risks of kids keeping stuff bottled up?
Well, then we are talking about depression and anxiety, and sometimes, as Irwin already mentioned, self-harm and suicidality. And I think that, there have been some rather famous examples of people who didn't transition until adulthood, and when they talk about their earlier experiences, they really talk about being miserable, and just, I think, really truly that incongruence is hard to manage.
What are the signs of distress that a parent might look for?
I think that they're similar to many other struggles for adolescents. I think there could be substance abuse. There could be a lot of isolation. I think in little kids, it really is much more about wanting to, as Irwin said, claiming I am a boy or I am a girl, and being much more insistent about those kinds of issues, and then any kinds of difficulties that they may bump up against with their friends or friends' families or things like that. So really, truly, the earlier that this gets identified, as with many other things, and discussed and supported, the problems end up, I think, being fewer.
I think if all of us, parents, teachers, all the adults in the community, made a point of every so often letting people know that for some people their gender doesn't happen to match the sex they were assigned at birth. If every 3-year-old heard that once or twice, the kids for whom it mattered, they would hang on to that information. And the other kids, it would be like 1,000 things they learn that are like interesting factoids that don't really relate to them. But if parents were able to indicate to their children that they're open to gender diversity, just as it's important that they indicate to their kids that they're open to varying sexualities in their developing adolescence, and whether that's because they have family members who are LGBT, or because they're watching a TV show together and the parents are making respectful comments about what's happening on that show, or there's a kid in the community who's transitioning and so their own child hears what they think about that. I think if young people knew that they were going to be accepted and supported as they are, then they wouldn't need to hide it, and they wouldn't be dealing with all this internal challenge of feeling that there's something about them that is just wrong, it's sick, it's sinful, whatever language they've heard to refer to that, it can't be, they can never be happy. As Darcy said, the depression looks like depression, whatever the cause. So if your child is depressed, you couldn't really presume it's related to gender identity unless maybe they were a very strongly gender nonconforming kid. But I think it's more about getting the message out from all of us that this is just part of human diversity, and we think it's great for people to be who they are, and we as a community are going to support them.
Let me ask you this. We hear a lot these days about being allies of populations that are marginalized in this culture. And I want to ask you just quickly, if you can, to tell us some ways that people can be active allies to transgender people.
I would say always speak respectfully of transgender people, and if you overhear somebody being disrespectful, speak up and let them know that you don't care for that language. If you know somebody who is identifying as transgender in some way and asking that they be addressed with a different name or pronouns than you're used to, which could include they pronouns for people who identify in a non-binary way, do your very best to always use that name and the correct pronouns for them. And in fact, to go out of your way, because we use pronouns in English mostly when we're talking about someone who isn't there. So if you and I are talking about someone who we both know is transgender, I would go out of my way to construct a sentence that uses their pronoun to help remind you, in case you're not used to it, that that's how that person wants to be addressed. So I think to proactively, when you have someone in your community who you know of as transgender, to really think about being an ambassador for them and just speaking positively of them and naturally about the way that reflecting the way they're different without making a big deal about it being a difference. And I think also we can support legislation in whatever state we are in the country and nationally if possible that endorses transgender civil rights and non-discrimination. We still don't have employment non-discrimination for transgender people. And obviously these bathroom bills are just absurd. The idea that you're going to have to prove your biological sex when you go to the ladies' room, is that how you want to live? And should a transgender person have to live that way?
Anything to add, Darcy?
Well, just briefly that I think it's okay to not know, and that to be respectful and ask kind questions and recognize one's own ignorance is actually a really good way to be honoring transgender folks and just knowing that it's okay.
Great. Thank you so much, Irwin Krieger, for joining us. I want to plug his book again, Helping Your Transgender Teen, A Guide for Parents. And also Darcy Gingerich, you are wonderful to join us today. I think you're rushing back to see clients this afternoon. So I really appreciate both your time, and I hope maybe someday we'll get you back on.
Thanks very much. It's really a pleasure.
You are welcome. Thanks again for joining us for another episode of Keep Talking, a community dialogue about mental health. I want to thank BCTV. I couldn't do this program without them. They are tremendous support to the Brattleboro retreat, and I look forward to seeing you once again.